You are about to meet a man with an incredible weight loss story. But first, please welcome back bariatric surgeon Dr. Joseph Chebli. He is the medical director for the bariatric surgery program at Venice Regional Bayfront Health. Now, tell us who you brought with us, Dr. Chebli.
Thanks for having me back. I brought Sue. She's the wife of a dear patient of ours, and she'll tell you his story.
How did you pick Dr. Chebli? He lived a long way from you, right?
I picked him for his looks.
Oh, good choice, but you didn't know that when you picked him.
No, I didn't. We picked him. We have several doctor friends, and we knew this was going to be a really important decision in Bill's life. So we asked around, and he came highly recommended for bariatric surgeon on our coast.
Well, show us some pictures of him before. Let's see what Bill looked like. How much did he weigh?
414 pounds.
Wow.
Oh my gosh.
Oh.
He's a big guy.
So he had a lot of also medical issues also with this weight?
Yes, he did. He had sugar, he was diabetic, he had high blood pressure, high cholesterol, he had bad knees, just...
A slew of
It must have
things.
scared you.
Yes, it did.
Okay, well, let's see him now. Come on out, Bill.
Oh, wow.
You lost your horns from that last one.
You lost a lot of you.
How much did you lose?
180 pounds.
180 pounds. And how long?
12 months.
Wow, that's amazing.
And how do you feel? What's the difference in you?
Well, your energy level's up. You don't have the aches and pains when you're a fat boy.
You can fit in the chair now.
You can go into somebody's house and make sure an antique furniture you're sitting on the break. You can just sit on anything. You don't mess up.
Dr. Chebli, what was your thoughts when you met him? I bet you were a little worried. What were his problems?
Yeah, we were worried, but these are two very dynamic, exciting people. So we had a good time the first time we sat down together. We always do when we see each other. But Bill had he has type 2 diabetes, had type 2 diabetes on 3 medications, high blood pressure on 3 medicines, lipid problems, elevated cholesterol, sleep apnea. So he's off all his diabetic medicines, he's off all his blood pressure medicines, he's off all his lipid medicines. So he really has done incredibly well.
So his health was actually in danger when he came to you.
Yeah, there's no question about it. For Bill and for other patients of ours, especially our diabetic patients, I mean, they are going to have a shortened life expectancy. And this surgery not just restores health, but extends life. And,
of course,
well, you guys,
Miss Susan had a lot to do with it.
I know, I was going to ask, so, you're not on the medication, but what are some of the other benefits that you guys have noticed? I know you mentioned a couple.
Yeah, I got my husband back that I married 40 years ago.
I gained the weight slowly over the years, and what can I say?
And he blames it on my cooking.
It's on her cooking. But she's the
I do
reason
love
I
to
lost all the weight, because you got to have a good support cast
Yeah,
with
tell
you.
us about that.
You
How
got to
does
have
that
that. You got to make sure your meds are there. Then they pulverize the food just right, or you can't take
There's
it.
different stages
Different stages of
through this whole year process you have to go through. And as his wife, I wanted to make sure that I did everything correctly. I read the book front and cover. A couple things I didn't do right, but we
It looks
correct
like
them.
you
It
did it
worked out
right.
very well. Do you exercise now?
My son's got a company called disasterclean.com. And,
And a good father.
and I help him out going around just the jobs,
Well, you
taking
could do
stuff.
things with your grandchildren.
Yeah, and you keep active,
Yes, like catch snakes.
Yeah,
Look at that chair. We can actually see the chair
yeah,
now.
you can see the chair now.
Dr. Chebli, tell us about the importance a wife or a partner can have in making a successful transition.
Yeah, there's no question. Support is a critical piece of this process. And honestly, you'd be hard-pressed to ever meet anyone. Yeah, but honestly, Sue, she always had a notebook with her. She always knew exactly what Bill should be doing. She took notes. Sometimes my job is tough love, and she was always there to support me to help Bill do what he needed to do.
Wow.
And that's everything.
You got to go to the
really.
appointments. You got to be involved in it. You've got to make sure that.
If you don't have a
Or
good
it
partner
won't be
helping you, it ain't
successful.
gonna work. Because somebody's got to be there all the time and say, remind you this and that. Because if you get this big, you got a bad eating habit. You think about, I never realized you could smell a pizza through a TV till I had this done.
Does it still bother you? Do you still want to overeat?
I have no desire for food at all.
Really?
I force myself to eat the protein, 80 grams of protein a day, but I could go without eating it. I could lose more weight if I want. I'm down to 230, but I could keep going if I wanted to, but I want to stop
Is
there.
he at his ideal weight?
He's close. I mean, Bill actually started with a body mass index of 51, and those patients often don't lose as much percentage excess weight. And I tell him all the time, he literally crushed it statistically. He lost 82% of his excess weight and
Wow.
dropped over 20 BMI points, which is remarkable. I mean, the average patient in the U.S. loses about 15 BMI points with the surgery. He lost 20 plus.
What about his other medical numbers? Have they improved?
Yes, like as I was saying, his diabetes is in remission, his lipid problem is in remission, his high blood pressure is in remission, his sleep he had sleep apnea as well.
And what about
Life expectancy.
Yeah.
Life expectancy, no question. There are a lot of
can listen,
studies.
Bill.
I'm sorry. So no, just from a life expectancy, because that's really what it's about, life
Yeah.
and death. So patients who have diabetes, heart disease, who have surgery compared to the people who need it who don't, the benefit is between 67 and 92% mortality benefit. That's
Wow.
those
Life
are
and
actually
death.
lives saved, life and death.
Wow.
Yes, no question.
And quality. Like now he's a
Yeah.
quality.
Yes,
Yeah,
yes,
you can do
no
things
question
like-
about it.
The
With the
spark's back in the
grandkids and-
spark plug.
and to not have to
Back in the
to not
that
have
sounds
to take
good.
the
I like
medication.
Yes,
Yes.
no
Oh,
question.
yeah,
no
you take
question
16,
about it.
18 pills a day down just taking
No,
vitamins.
it's just vitamins now.
Twice a
Just
day.
No
supplements.
prescription medication.
Well, I know
That's
I'm very
amazing.
impressed. You look great.
You
Thank
do.
you. I like
who
you,
can
too.
have this surgery?
I think so too.
Dr. Chebli, who can have this surgery? What's this for?
Yeah, this is for people who have what we call morbid obesity. So we use the body mass index but in plain English, people who are 100 pounds over their weight, 80 pounds over their weight with at least one serious medical comorbidity or condition, like type 2 diabetes, high blood pressure, sleep apnea, heartburn problems, joint disease, all of these
those
things. Yeah.
Well, everybody I'm
Congratulations.
sure out there that needs to lose weight has a lot of questions about this. You can get your questions answered if you go to VenusMBS.com. That is so exciting. Thank
All
you
right,
so
let
much
me
for
see.
bringing him. And
And
then
I
want you to
see you
stand.
again.
Stand up together.
look at this couple.
So excited about your life
impressive.
together.
40 years of
What a
marriage.
couple, 40
That's
years.
wonderful. Congratulations.
Oh, congratulations. Thank you, Dr. Chebli.
Thank you
Thank
very
you
much.
for all
Thank
of
you for
us.
having me.
Enjoy
And
your
we'll be
spark.
back with an iconic song. You may remember this.